Hi, my name is John Donnally. I'm a minimally invasive spine specialist doing spine surgery of the neck and back. I also manage many conditions non-operatively of both the neck and the back. I'm located in Dallas, Texas, and the group that I'm a part of is Texas Spine Consultants. I went to Texas Tech. I was there for 4 years for medical school. I knew I wanted to become a surgeon I had a high school injury my senior year. At that point, I knew I wanted to go into some type of service field. I was looking at maybe going to a military academy or something like that. I just knew that service is where I wanted to go. I fortunately or unfortunately had a very big sports injury. My aha moment was being surrounded by those doctors who kind of surgically took care of my shoulder. And then after that, I was like, well, you know what, this is a great service industry also, and really got to help people as well. Slowly you start really helping patients get better. You have patients that come in with a foot drop, or patients that have, for whatever reason, not been diagnosed when they've seen 4 other doctors. And I look at their MRI and X-ray, and I'm kind of like, man, this seems like a very outpatient, easy surgery, both for the surgeon and for the patient. Do kind of a handful of those, and patients start to get better. They get to be very happy. They bring you cookies or flowers and things like that, and you're like, wow, you're actually starting to make a difference. So it's rare for a patient to see me and not have function of a leg. Usually that's the last stage of when something goes bad. Obviously in Melissa's case, that was something where, because of the rapid progression, that was something we were able to get to fast. But typically, patients are coming to see me with months of back pain that's now become leg pain. The numbness and tingling is bothersome, but a lot of times patients can bear through it. It's once they start getting that shooting pain into the buttock, into the back of the thigh, going down the leg. Same thing with the neck. It could be in the shoulder, going down the arm, the numbness and tingling in the fingers. When patients haven't gotten better, when they've been trying to do injections or chiropractic therapy or traction and none of it's working, that's when patients come to see me. But I tell patients all the time, and providers all the time, I want to be the quarterback. I want to see the patient early, and I'll send them out to go do those things, because I feel like I have a good sense of when a patient does need surgery and doesn't need surgery. So if I'm starting that non-operative management, that's another competitive edge that I like to provide my patients. Surgery stinks. No one wants surgery. I don't want my parents to have to get surgery. I don't want to have to get surgery, and that's coming from a surgeon. But a lot of it is just fear of the unknown. It's like same thing buying a car, or buying a house. It's just the fear of the unknown is just the scary part. So if you have someone who's already been working with that surgeon or that provider, if you have someone that already kind of knows what to expect, that really kind of helps answer a lot of those questions. There's a lot of things that the surgeon is going to answer for you, but there's a lot of questions. I've never operated on myself, so I don't actually know exactly what some of these things you might be thinking are when you get home. Having the patient partner is great because it answers some of those questions that the patient might not even know to ask. I highly recommend connecting with a patient partner mentor today.